Critical care in Brantford comprises a 14-bed critical care unit on the top level of the D wing, and this unit is now about 10 years old, built as part of the new addition to the hospital. It comprises a core group of people that provide critical care services to our sickest patients in the community.
Depending on the health state of the patient or the actual disease process, that generally dictates the type of equipment that we would have to use. But that may include mechanical ventilation, as well as BiPAP machines, and they are used for patients that would require assistance in respiratory support or breathing problems, as well as our specialized beds. All of our patients that are in the critical care unit require a specialized bed. Critically ill patients generally tend to be in bed for a little bit longer than most patients, so that's where the superior surface or mattress becomes very important in their recovery phase.
We have a lot of patients that come through the critical care unit. We average between 200 and 225 patients per month through our CCU. So if you count that up over the year, that's a lot of people in the community that will actually have a family member or a friend or a relative or somebody that they know well that will end up receiving care in this unit. The Brantford General Hospital and Brant Community Healthcare System have a requirement and an obligation to continue to provide critical care services to this community and the surrounding LHIN. We need up-to-date, state-of-the-art equipment to continue to provide those services. That includes mechanical ventilators, beds, and we'd like to have a new up-to-date bed and potentially a ventilator for every room in the critical care unit. We prefer not to have to borrow equipment from other institutions.
I would say in the last 18 months to 2 years, 88% of our patient population has used at one point or another in their acute care stay in the critical care unit a mechanical ventilator or a BiPAP.
In order to continue to provide services and meet the needs of an aging and growing population in this community, the need for service is only going to increase.
You know, our need is far greater than our funding envelope. So any type of support, especially what we're seeing with the donor support, is phenomenal. We'd never be able to do this without our donor support, and our challenges would be much greater in having to be able to replace or even repair some of this equipment.
I just want to make a sincere thank you to the Brant Community Healthcare Foundation and the people of Brantford, the donors that have provided money to the foundation to allow us to do our job to the best of our ability.
We're very proud to be able to serve this community in Brantford, and we would not be able to do that and provide excellence in care without the assistance from the foundation and your donor support. So again, thank you from all of us.